Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati Spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Bermel.
Good afternoon, and thank you for joining us this Saturday on American Medicine Today. I'm Kimberly Bermel, joined by executive producer of AM Tampa Bay, Ethan Euchre.
Good afternoon, everyone.
Good afternoon. And to my right, I have Jeff Wagstaff sitting next to me. He is our co-host of American Medicine Today. Thank you for being here.
Howdy, howdy, howdy. Thanks for having me.
And, of course, we have world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute. Thank you for joining us.
Hello, hello.
Everybody's excited today. I love it. Jeff just got over H1N1. He was near death's door for like a week and a half, and now he's excited to be back.
So I would like to warn the audience, if I'm a little overbearing or slightly annoying today, I have like an entire month's worth of orneriness stored up.
That's no excuse. We'll just have Kimberly slap you if you get out of control.
Whoa, family show.
Well, we wanted to get into a little bit about some statistics. So we're always talking about how wonderful the Bonati spine procedures are. Well, that is true, but we've found out that the number one reason that a lot of open back surgeries are not effective and that some patients have continued pain after surgery is because the area that was operated on wasn't the true cause of the patient's pain. And in addition, we're finding out that the infection rate for open back surgery is at 4.5%, and immediate complications for traditional open back surgery is at 31%. Now, staggeringly, there's a 41% increase in the use of painkillers, particularly opiates. And for those that have undergone open back surgery, we've said before, and we're going to state it again, the statistics for single-level fusions have a failure rate of over 60%. And 3-level fusions have a failure rate of over 85%. Those are just staggering statistics to me, and I'm sure everyone else listening.
Indeed.
Now, the sources we got those from are the Division of Epidemiology and Biostatistics, the Department of Environmental Health, and Health Insights Today, the Scoliosis Research Society. So it's not just us making those statements. Those are valid statistics. Now, Dr. Bonati advanced medicine and changed medical history forever, and he is the genius behind the exclusive Bonati spine procedures, the most effective and only true alternative to open back surgery on the market today. Alfredo Bonati, MD, single-handedly invented, patented, and perfected the field of what's known today as minimally invasive laser spine surgery. And the successful procedures that we are referring to are the Bonati spine procedures, and they are exclusive to the Bonati Spine Institute. Without his contribution to medicine, there would be no alternative today to those highly invasive open spine surgeries. And over 40% of the patients seen at the Bonati Spine Institute have suffered from previous failed back surgeries at other facilities. That considered, our patient-reported success rate is over 98%. So Bonati succeeds where others have failed. Don't just take my word for it. We have patient Dr. Dean Spitzer on the line, who received treatment at the Bonati Spine Institute in 2008. He's going to tell you firsthand how those patented Bonati spine procedures helped him get back to life.
Let me clear something really, really important. You just said something, Kimberly, that is extremely important. Mm-hmm. The comparison that you did between infections and results is staggering to see that we don't have infections after 45,000 procedures. Mm-hmm. When you say we don't have infections, people will never believe that. But you need to understand that the procedures require that we go through a tube, and the tube is constantly irrigating with fluid. Mm-hmm. That fluid has antibiotics. So the possibilities to get an infection with a small incision and constant irrigation is almost very, very seldom will happen. Mm-hmm. For example, when you do arthroscopic procedures of the knee, 1% is the sort of infection. But the knee is more exposed. When we do the spine, the exposure is very, very small. So the result of a possibility to get an infection is almost zero.
How big is the typical incision, Dr. Bonati?
It goes around, depending on what procedure we're going to do, but if we do the biggest type of a exploration in the area, it's around maybe 16 millimeters, the maximum radium that those tubes will have.
I'm not European. I don't know millimeters.
Is that the size of
I
a
don't know
quarter,
metrics.
maybe? About
Yeah.
a quarter?
Is
A
small,
dime?
small, it's like the size of a dime.
Wow.
Yeah,
That's
size of a
incredible.
dime. And maybe the dime is even a little bit bigger, but that's the size.
Wow.
And then you go 6 inches down, and when you do that, and you're irrigating constantly, all these tissues are constantly floating in fluid with antibiotics. Some possibilities of infections, almost none.
So where does all that fluid go, though, that you're pumping in? Is it sucked back out?
You're using another system that is sucking all the fluid out.
Interesting.
The fluid will allow to clean the scope, so it's constant correct visualization there.
You know, Dr. Bonati, every week we talk about the failure rate of traditional back surgeries. But one thing that when we all started the show and I started researching and educating myself on traditional open back surgery, the part that I found so amazing was when they open a patient, they have to move the organs away to open that area up for the surgeon. We saw in the videos that you showed me where sometimes those organs are set on a tray or set aside. I would think the recovery from not so much the spine surgery, but from the incision and all of
Just the disruptive nature of having
Yes.
all of your organs moved
yeah, to have
around.
all your organs removed and then put back in place. I would think that recovery time would be months.
But it's not just that. It's the tearing of the tendons and the muscles, and that the repair on that takes a long time, Dr. Bonati, correct?
Yeah, but you guys are exaggerating a little bit. The incision on the back is around 6 inches, and the source why you can have an infection is because you have a couple of surgeons, a couple of assistants, you have a 6 inches opening, and the people inside the operating room, even if it is with all the special air to maintain the area clean, the whole thing, you always have contamination, and the contamination later on can be a problem. 6 inches is difficult also to be treated. So when the nurses that they're in the hospital, they are moving from one patient to another one, sometimes hygiene is not done properly. And then an infection on this type of a population of patients with open surgery is devastating, is really, really bad. Now, you Jeff, you're talking about moving organs and the thing. Well, that is when the patient's been operated with a type of a fusion with an anterior approach and a posterior approach. That is extremely, extremely aggressive surgery. It's being done. And I think it's totally unnecessary. We have patients that they have this type of a procedure done. They come to us. We corrected that problem, and we found that the patient didn't need that type of surgery. And the things that they were done are even worse for obtain better results. Now, the first thing that we need to do is take the screws, take the plates, the whole thing, and have the area enough clean for us to start to correct the problems. But as I said, the failure, the possibilities of infection is because of the large amount of hours of exposure, a lot of people in the operating room, and large surgery.
We'll get to more on that in just a minute, because not only the infection but also the invasive nature of those, I think, is what Jeff was referring to as far as some organs and stuff being taken out. Because we've talked to those previous patients who had been told, had they gone through those procedures, they'd have been sliced open in the front, sliced open in the back, and there's no direct path to the spine, I don't believe, from the front. We'll get to that in a minute, though, Dr. Bonati. But first, we'd like to head over to Dr. Dean Spitzer. He's on the line. He's a patient of the Bonati Spine Institute, had surgery in 2008. Thank you for joining us on American Medicine Today.
My pleasure, Kimberly. Thank you. And one of the reasons why I'm so glad to join you is because I get to thank Dr. Bonati personally for all he's done for me.
Thanks.
Thank you so much, Dr. Bonati.
Thank you, doctor.
Well, we want to get into how the whole procedure changed your life, Dean, really from the beginning. We're kind of coming up against a break. There is a couple of minutes left, though. So why don't you take us back to where you started, when in your life you started to feel pain, why, the causes, and just kind of paint the picture from there. And then once we get up to that point, we'll take a quick break and we'll hear about your experience at the Bonati Spine procedure. But
Sure.
Take us back to the beginning.
Yes, well, I'm an inveterate runner and walker. I've probably walked over several million miles in my life. And I didn't realize it, but I had bad posture. And it's sort of like the alignment of your tires, your wheels. You know, it can do a lot of damage. So being out of alignment for all my life and putting so many miles on my body just did a lot of damage. And after a while, I was in so much pain, especially with the sciatic nerve, I couldn't walk. I was on crutches. It was just horrible. And I knew I had to do something, and I didn't want open back surgery. And so I heard about the non-invasive surgery, and I did my research on the internet. And initially, I went to Laser Spine Institute because it was near us in Tampa, and I had not heard of the Bonati Institute, and they didn't do much of anything. So I continued my research, found Dr. Bonati and the Bonati Institute, and I am totally pain-free and
Spoiler alert.
Continuing to walk and run and just have a great life.
See, Dr. Spitzer, you just gave it all away. You just ruined the whole story. You jumped to the conclusion. Come on now.
But that's okay. You know, I'm a public speaker, so it's important to have the beginning and the end, and then fill in the middle.
Exactly, and we're going to do that in the next segment. And I want you to walk us through the entire, the whole, rigmarole of what you went through, because it's still very interesting to me as a layperson of what you guys go through. So I'm going to put you on hold here, Dr. Spitzer. We'll get back with you in just a second. Kimberly, if people want to get in touch with the Bonati Spine Institute, how do they do so?
Well, they can give us a call at 855-267-0482, or they can visit us on the website at Bonati.com. If you're local, head out to Hudson Avenue and US 19. We'll hear more from Dr. Dean Spitzer on the flip side of the break. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. The Bonati Spine Institute is proud to announce more than a 90% success rate in over 45,000 patent-protected spine surgical procedures. Call us today at 855-267-0483 or visit our website at Bonati.com.
All my pain is gone. Gone.
Today I am totally pain-free. Nothing. No after effect.
I'm pain-free, and I have had to take any pain medication.
Today I am pain-free for the first time in over a year, and it is so awesome.
I only wish I'd known about it earlier. Right now, I am completely without pain.
Sitting here in this office right now, pain-free, eager to enjoy the rest of my life.
I am feeling great.
I feel 100% better, like a new person.
Today I feel absolutely fantastic. It's just incredible, the relief I feel right now.
Today I'm completely pain-free.
During the procedure, I literally felt the pain melt away. It was fantastic.
I feel so good.
It took care of my headaches instantly.
It's incredible. It's really incredible. It gave me my life back.
It's just wonderful.
I feel fantastic.
It is just absolutely amazing.
So I'm hoping to be climbing hills in a few weeks.